Describing Dr. Reidy in words, let's say 3 words, would definitely be loyal, dedicated, and heartwarming.
I really admire her. In my future, if I want to be like somebody, it's difficult to be like her, but definitely I would like to be her.
I would say you have to meet her because she's wonderful. She's an absolutely wonderful mentor, always encouraging, always supportive.
I think she has all the quality to be a good pediatrician, to be a good nephrologist, but also a good human being. That is what is important in this world. You would get so many doctors, but a doctor with a good heart, she's one of them.
Definitely my earliest memory is going to Dr. Reidy, and I would always make my mom answer her questions because I was a young kid. And, you know, kids, when they go to the doctors, they don't want to speak too much. But she was always calm and kind, so I never felt too afraid or too nervous. Even as I got older, I would take on those questions earlier than I would with other doctors.
As a leader at all levels, locally, nationally, internationally, she's a perfect example of what Einstein and Montefiore attempt to achieve with the mission of excellence in education, scholarly pursuits, and citizenship towards the community and those whom we serve. She has shown tireless ability to care for critically ill children and continue to pursue the best possible outcomes in these patients.
She's wonderful with patients. It's always a joy to round with her. When I was a fellow on service with her, it was fun to round with her. She would make sure that the family understood everything that was going on, and then she would spend extra time with the kids to make sure they understood what was going on. If they were younger, she would just play with them, and that was always fun to watch and to see someone who really has a lot of joy in their job and in their profession.
I do lots of things at CHAM. I am involved in clinical medicine. I take care of patients in the children's hospital as well as in the outpatient department. These are all children with kidney problems, whether it's an acute kidney problem or a chronic kidney problem. And then I do a lot of research. So that's at the Children's Hospital and at the Einstein College of Medicine. I am involved with bench research. So I have a lab where we look at how the kidney responds to injury and if we can make it go to healthy repair versus scarring, which would lead to chronic kidney problems. And then really had very formative experiences during my fellowship at Montefiore Einstein. I was trained in how to look at the kidney in the developing mouse and got really interested in kidney development, partly through my fellowship. It's so much fun to both be able to do clinical medicine, but also do research. It really drives you to look back into the science when you're with your patients to make sure you're giving them the most up-to-date information, the best options for therapy. The other big aspect I love about it is you get to mentor. You get to work with trainees. And for me, I think that's one of the best parts is I love working with our trainees and seeing them grow and in some cases become researchers themselves, pursuing that as a career. I just feel so thankful for all the opportunities I've been given and, all of the people that inspired me over the years and helped me grow as a physician, as a researcher. The fact that I was given opportunities to train at Einstein and Montefiore is what I feel proud about, is just that I had these opportunities to learn and be a part of the very rich history that Einstein has. I mean, it was one of the first pediatric nephrology divisions in the country, and I feel proud to be a part of that history. I have 2 adopted children. One is, I'm going to cry now. One is almost 15 and one is almost 9. And they are such joys in my life. They have taught me so much. And, in terms of talking to patients and families, I've certainly learned so much from them. If it's anything, even like not drawing blood as much as possible because they don't like it. But they just inspire me because they show me the health and the lives that I hope my patients can have. They are able to go to school and learn and go to camp and all of these things. And so I just wish that I could make my patients' lives like theirs and as healthy as possible.